It's a very simple and it's a very understandable lecture, and mostly everyone is doing that, but there are few components which we miss and which we are going to learn. So it's a more of a theoretical and more understanding topic, and you can always share your experiences if you're doing the same. Okay. So today we are going to understand about the introduction of the same, roles of different healthcare systems in the care of a geriatric population, communication strategies and collaborations, care planning and coordination. So, as we know that the elderly problems or the geriatric problems have a lot of problems together, right? So, every doctor, every physician, or every healthcare worker has to come together and create an interdisciplinary program to treat the patient to make sure that the health, the quality of life, and the prognosis of the disease gets better. So, most common condition what the patients come us is obesity, eye problems, heart diseases, diabetes, myelitis, osteoarthritis, anemia, emotional support, cancer, memory, high blood pressure, osteoporosis, or gallstone. So many patients come with a lot of problems together. So it is very difficult for one doctor or one physician to treat everything. So that is why a holistic approach and an interdisciplinary team and teamwork should be created to make sure that everyone is working for the same goal for the betterment of the patient, and also the treatment strategy should align, nothing should overlap, and everything should work in the power of the patient. So it's a dynamic process involving two or more healthcare professionals with complementary backgrounds and skills, sharing common health goals and exercising concreted physical and mental efforts in assessing, planning, and evaluating a patient care. This is accomplished through an interdependent collaboration, open communication, shared decision making. This in turn generates a value added patient, organizational, and staff outcome. So basically, it's a dynamic process where you have to create a teamwork. You have to keep in touch with all the physicians at regular amount of times. You can always keep meetings in order to discuss about every patient in detail, so that the planning, the evaluation is in one line, and the treatment goal is in proper way to make sure that the prognosis is getting better. So just this is an example of interdisciplinary health team for independent older individuals. So specifically there are different components what work together to make the health better. So one is a nutrition part. So as we know, with the old age there are different conditions, and every condition has its own a nutrition component which has to be considered. Then is physical activity. As you know, with geriatric population, the physical activity, the stamina, the strength reduces. So physiotherapist comes into picture to make the patient more mobile and make sure that the physical activity is good. Then some of the patients who are staying in old age homes. So there are social workers which come in order to help these older individuals, so that all the physicians come together and make sure that the treatment is going well. Then is something called as a team leader or a team coordinator, which is called as a geriatrician. So what is a geriatrician? It is a basically a physician or a MD medicine doctor, where it basically leads the team of all the different healthcare professionals like social workers, nurses, caretakers, physical activity or physiotherapists or nutritionist, or even your caregivers or the family members. All the information is passed through everyone. Everyone is working in the same line to make sure that the patient gets better and the health gets better. Is everyone with me? Any difficulties?
Yeah, ma'am.
Okay. So I hope everyone has a habit of discussing the your conditions with the different physicians or your patients with different physicians. Do you do that?
Yes.
Okay. Can anyone give me one example? I just need one example. That's all.
So most of them are on BP medications, right?
Hmm.
So, and the
Yes.
sugar medications as well. So, to align the exercise timing as per their insulin injection, the units of insulin that they are taking at what time, so that it is not causing too much of drop in their sugar levels.
Superb.
So, I just
So,
take care of that.
so how do you
Yeah.
speak? So you will take care, or the the doctor will take care.
Yeah, so we do check the progressions, like, the sugar, fasting sugar, I keep checking. Like, I ask them to check and let me know, and the units of insulin they have been taking at what timings. And I try to make sure that exercises are well away from the insulin shot dosage.
So
And if
yeah.
yeah, if there
Yes.
is any change in their what to say, sugar, fasting sugar levels, it is going too low, we communicate with the general physician or the diabetologist if there needs
Per-
to be any change in the insulin dosage, if there's an
Perfect.
improvement in the fasting sugar.
Perfect. So, as very correctly mentioned by Prachi, that a close team of physicians and physiotherapists is required because every medications or everything has its own side effect on exercises or any other nutrition part. So, if y'all are all talking together, so it is always in a betterment for the patient. So nowadays, what I do, I have very many geriatric population patients, so these patients require certain nutritional care or the dietitian care. So I usually speak to, I have a dietitian with me in my team. I speak to them that these are the certain set of problems. I want to improve their muscle strength. If I want to improve their muscle strength, I will make sure that I ask my dietitian to add good amount of protein for them, add good amount of fats for them, so that they will able to do the exercise, they don't feel weak, and the muscle strength will get better. So if you tell your goal, again the dietitian will work for the same goal, and everyone will work for the betterment. So there are different roles of different healthcare systems. So basically, there are different doctors which are coming into the picture. One is for oncology, palliative care, cardiovascular disease management, endocrinal disorders, neurology, psychiatry, high specific care, physiotherapists, and social workers. So these are the different roles of different healthcare workers who are coming in order to treat the geriatric population. So, what is the main aim for the interdisciplinary healthcare? So, first is always establish a patient centered goal. So, every doctor in the team should have one goal, and the goal should be the betterment of the patient. If everyone is working for the same goal, it is very easy to comply to the treatment. Cover the domains of medical problems, functional ability, cognitive or psychiatric health, or social circumstances. Have representations from key disciplines. Bring opinions together openly. Agree an overall aim, agree next steps with the time frames, allocate the responsibilities, reconvene to revisit and progress regularly, and communicate the outputs from the multidisciplinary team meetings. So everything has to be in detailly done by every doctor. It's just not one person who is a team leader is doing. Every healthcare worker inside the team will do all these functions in order to maintain the communication, in order to maintain the treatment line in a one way, and maintain the compliance of the treatment. The discussion has to be very open. There should be regular meetings or regular rounds for each and every patient to be discussed. So I used to work in Manipal hospitals. So whenever there was a morning round, as a physiotherapist, I used to always go on rounds with the medicine doctor or the cardiovascular surgeon or the pulmonologist in order to understand the medicine part, in order to understand what are their views for the patient. And also, they used to ask us, is the patient fit to be discharged? Is the patient fit to do the exercises? What are your concerns? Do you want to add any bronchodilators or any, cough removal medicine so that it is easy for us to do the exercises? So, such healthy environment should be done so that the patient's recovery is faster. In India, it is very uncommon, very less hospitals practice this because there is some kind of ego tension which is always there in every physician and every healthcare person. Some orthopedics will randomly write exercises and give it to you, that you tell your physiotherapist to do that. No, this is wrong. That is not their domain. They usually have to ask the patient, that your physiotherapist, you should ask them to assess them properly and then give you exercises. So such thing is very commonly practiced in India, which has to be absolutely changed, and make sure that everyone is working together at the same level and with the same direction. So there are few positive strategies and positive goals which every doctor in the healthcare professional team should work. Every healthcare professional should have a positive leadership and management attributes, should have a clarity of vision, supportive team climate, individual characterized that supports the multidisciplinary work, respecting and understanding of the rules, appropriate skill mix, communication strategies and structure, personal rewards, training and development, appropriate resources and procedures, and quality and outcome of the care. So, these are the few qualities what every healthcare professional should have to make sure that the team is working properly. If any of these things are missing, it will be a missing or a gap communication, and that can lead to a problem for the patient only and not for yourself. Everyone clear till now?
Yes, ma'am. I have
Yes.
something to share. Like,
Yes.
I'm occupational therapist and I work in palliative care plus it is old age home. So we
Okay.
see many of the cases like cancer and like old age, whatever disease there are. So like occupational therapy also comes in the picture every time because like uh, uh, they have many cognitive issues. So like we treat them as the strength and everything, but also we treat them like cognitively, giving
Correct.
them mental exercise and everything. So just
Perfect.
my point that occupational therapy also comes in the picture.
Exactly. This is a very important thing. So many patients who are into palliative care and who are looking in order to go back to their original lifestyle to again come back to their occupational levels, or many of the children's, the pediatric children's who have cancers or some kind of fractures or any higher mental issues, where all physiotherapists or the pediatrician, occupational therapists, the social workers all come together to work for that one patient. So all these strategies, all these factors, and all these um, functions every physiotherapist, occupational therapist, or any healthcare worker should have, and always make sure that the ego is never more, the patient care is the first option. Even if you
Yes,
feel that there is
exactly.
something is a problem here, you should openly discuss with the teammates, and you should always come to a solution rather than I have seen many of the team members, they have some wrong thoughts or they have clash of opinions, but always end of the day we all are working together for the patient care. Okay, so all sometimes
I
if you
agree.
have to go down, it is completely fine, you can step down, but if you feel your opinion is important, you should always keep that in the decorum. Everyone clear? So this is a very nice example and an infographic where wow, everyone is working for the basic patient care. So in this, there are in the interdisciplinary team also, there are different topics and domains of the healthcare worker. So first is always a core team. So core team is the healthcare professionals which come in direct contact with the patient. Okay. For the proper treatment. So in core team, usually we have caregivers, a patient and the family, the nurse, the medical assistant, the main physician or the doctor, and the person maybe who is in contact of appointments. Then as a extended healthcare. Extended healthcare means when the physician gives a reference to some other doctor or any other physician. Suppose the patient comes in the hospital for a heart problem, but the patient the cardiologist tell that I also need a renal opinion, basically a doctor who is a nephrologist. So what he will do, he will write into prescription that I need a nephrologist opinion. So that referral will go to the nephrologist, and the nephrologist will be an extended healthcare person, because he is not the first or the first primary doctor to be treating. He is a person who is coming into the picture after the reference is given. Then there are different people also. Some patients who are in old age homes, though social workers, healthcare providers, behavioral doctors, dentists, pharmacists, or any other physicians are other extended healthcare. There is something called as extended community care. So what your community means, when the patient is discharged, there are few community services which are there in order to maintain the condition once they come back to home or any old age home, like home health people, health behavioral people, social support services, or college support, school supports, or NGOs. These are the extended community care team. So every team has different set of physician, every team has different set of people, but everyone has to work together for the patient care. So whatever things have to have written in the file or written in the opinion of the doctor has to be properly followed by everyone. Or if they have any issues, they can immediately contact to the primary physician who is the treating doctor of the patient. Everyone clear?
Yes.
Okay. So this framework can be applied to your patient also. This is just an example about to understand at which levels the interdisciplinary team works. Next part is communication and collaboration. Again, if you don't speak, you will never keep your opinion. If you're never keeping your opinion, you will never treat your patient very well. So the communication is a key in any of the group discussions, teamwork, or any healthcare professional where we are working for the patient. If two people do not collaborate together, again, there will be a different line of thoughts, different line of goals, different line of treatment, and how the patient will get confused what has to be done at what time. When this confusion happens, the patient will not be compliant to the treatment and the prognosis will go down. Distinguish a speech and exchange. Discussion and sharing of opinions is the most important thing what everyone has to be doing. Desire a growing relationship and respecting our limitations and our boundaries. Allow the development of potential. Accept the four axes of communication. You can always ask, you can give, you can receive, and you can refuse. These four axes of communication is the must thing what you have to learn. If you, this is not only to your patient, but it is always ahead than that also into your personal life. If you accept these four axes of communication, you can make sure that you communicate with anyone however you want. Always remember, you can always ask, you can always give your opinion, you can always receive a compliment or receive any negative comment, and you can always refuse if you feel it is something wrong. To promote equity during the communication, to promote a creative exchange where two persons are at the end of the winner. So all these communication strategies and has to be accepted, has to be strategized for the patient care. Why it is most important? Effective communication methods directly improve the patient care and outcomes. When the healthcare providers clearly explain the diagnosis, treatment plans, and medication, patient understands the health better and know what actions have to be taken. Imagine a physician is just coming and writing in the paper and just going away, and the patient has so many doubts, has so many questions, and no questions and doubts are answered. Will the patient follow the treatment? No, they will not. They will not even understand what the doctor has written. If the doctor, physician, or the nurse or physiotherapist, whoever, will not explain the patient properly, they will not understand. If they are not understanding, the actions will not be taken properly and the treatment will not be compliant. So it is your job to explain everything in detail with the pros, with the cons, with the good and bad to the patient. Okay, even if it's sometimes I have seen many physicians and many physiotherapists, they keep buttering the patient. No, no, you'll be fine. No, no, everything is going to. No, please don't keep your patient into a blind spot. If you're doing that, you are wrong. Be very clear, be very transparent with the patient about their condition, about their prognosis. If you feel it is not going to be treated, so just tell, ma'am, it is very difficult, it seems difficult that it is not in my hand, you should go to this doctor. Don't keep telling, no, no, you give a try, everything will be better. No, it is not going to work well. You're just wasting time of the patient, you're just making the prognosis difficult. Communication leads to a better adherence to the treatment plans, fewer complications, and improved overall health. Poor communication, however, can have a serious consequences. For example, if the doctor uses medical difficult jargons that the patient doesn't understand, patient might take the medications incorrectly and miss the follow-up appointments. This is most commonly seen. I've seen many senior doctors, they don't even spend 1 minute or 2 minutes to talk to the patient properly. They just tell that the assistant will make them understand. Sometimes assistants also have some difficulty to understand. They will give a wrong information that can also lead to problems. Clear and open communication builds trust between patients and providers, encourages the patients to share their important health information, helps the healthcare team to coordinate more effectively. Everyone clear why it is important and why the collaboration and communication should be done?
Clear, ma'am.
Yeah. Okay.
Yes,
Next is
ma'am.
a
Clear.
very important topic about care planning and coordination. So now what do you mean by care planning? Care planning is basically whenever the patient comes with so many comorbidities or is in any chronic condition, a proper care plan has to be designed. If the care plan is properly designed, where the dietitian chart, physiotherapist chart, physician's chart, cardiologist chart, diabetes chart, sugar chart is properly mentioned with the proper time, the patient will be more compliant and the treatment will go better. A senior care plan is a tool to use to identify an older adult's need and coordinate their care. A care plan should outline the services and support a senior needs and who is responsible for providing them. When necessary, a plan should include a senior health condition. Specific treatment has to be done. It is important to make sure that the care plan includes the target time frame and which reevaluates and updates the plan. A care plan depends on the senior's needs, healthcare professionals, senior living communities, and home care providers. Families can also use this approach to make sure that the better management can be done for their loved one. So, what is care plan basically is usually when the patient comes home after surgeries, how we usually note down their BP, their sugar levels, their vitals. So, that is basically a care plan. So, everything has to be in a written format. Again, the care plan and the format can keep changing according to the physician and according to the condition. What are the benefits of care planning? It helps the caregivers to efficiently organize their duties, gives the senior the opportunity to express their care and preferences, provide a concrete list of task activities that has to be attended by the senior, organize the senior's medications, provide the details about when they should take and when it has to be administered, facilitate the communication between the care team members, provide opportunities to discuss long-term planning, which may include senior living options and estate planning. So care planning is usually majorly done by the nurses, the caretakers, and the family members. Okay, in this, basically, the organization about their activity timings, their medication timings, the physical activity timings has to be done in a proper format. It can also include vitals, it all depends on the condition. And whatever care planning you are writing, it should be accessible to everyone. Everyone should be accessible to see the charts. If the charts are clear, if any of the medication have to be reduced or increased, that care planning can be updated, and that care planning will help us to understand what should be the future options or what could be the long term planning. Everyone clear?
Yes, ma'am.
Yeah. Okay. So, what are the advantages of advanced care planning? It enables the healthcare practitioners to have a structured and meaningful conversation, encourages the patient centered care by putting an emphasis on the patient's own preferences, ensure that the care patient receives is in the line of the desire. In the event the patient lacks the capacity to make the decision, the medical staff will be aware about the patient's choices and ensure that the patients with the terminal illnesses will pass away where they choose. So, care planning has to always consider the patient's choices and patient's needs. If the patient is telling that I want to do this certain set of thing or I want to take this certain set of medication at this time, that has to be done. That has to be considered, that has to be followed by the person, whoever is making the care plan for the patient. The care plan has to be discussed with each and every professional, so that the doctor is also aware, the patient is also aware, and also the different healthcare professionals who are working together are aware about the care plan, and that care plan has to be followed for everyone in a same direction. Clear? So this is an example of the care plan. So this is a nursing care plan basically. I've taken from one of the hospital charts. So as you can see, there is a patient name, the care plan, who the person who has made the plan, and the date where it is initiated. So they have to first write the diagnosis. They have to write what is the problem list and what are the goals and outcomes, what interventions have done, and what are the evaluations, like short term and long term things, what you are measuring. So this care plan is of this date. So you can keep reassessing the care plans in every week, 10 days, or 1 month, depends on the condition. And the same format has to be followed. So you might have seen, right, when you go to a doctor, they give you a file. In the file, they keep writing the date and attaching the sheets, right? So that is also a care plan. So also the doctor will come to know that this patient had come to me 6 months back or 6 years back. This was the problem and this were the medications which I've given. And time to time the patient has taken a follow up, and the blood workup has also been registered constantly. Nowadays, in blood workup charts, also, you might have seen in 3 months there are different bullet charts. The 3 months, the HbA1c was 7.8. After 6 months of medications, the HbA1c is 6.4. So, that 7.8 to 6.4 is also one of the care plan. So, whatever intervention you have done in that care plan has to be noted down, jotted down, and documentation is important. Clear, everyone?
Ma'am, for physiotherapist and occupational therapist, we have soap notes as well, like for keeping
Yeah,
the records.
keeping the records. Exactly. That's the thing what we do as a physical therapist and occupational therapist. So, whenever the session is done, we usually write, right, what was done in the session. So,
Yes,
that was a
means
care plan.
in India it is not followed, but like usually like abroad, the soap notes and the documentation, proper documentation is done.
It has to be actually done in India also. Not many people do. Yes, in hospitals, definitely we have to do. But in clinical approaches also, not many people maintain a file, or they have some apps where they record what has done in each session. If you do that, it is very easier for you to, sometimes we see so many patients, we kind of forget what exercises were done. But that documentation chart will make sure that we remember that this exercise was done in such way, and I will be able to follow and progress in that particular manner. Everyone clear? That is how a physiotherapy care plan will work. This was just a overline understanding that how the care plan is done and how is the documentation done.
But why
Is
is it not
everyone with
followed in
me?
India, ma'am, actually?
Because nobody gives a lot of importance to documentation here. We have been taught in our colleges and our master's degree or any other clinical setup, but not many people follow. And also, there are guidelines in order to maintain the documentation, but not many people follow that. I don't know what is the barrier for that, but maybe it is too many patients at the same time, or they don't take the documentation seriously, or they feel that it is just normal exercises, we will remember. So we don't know the exact barriers why the documentation is not done, but it is very less practiced in India.
Okay. Ma'am, can I
Yeah.
take this as a norm, actually?
There are laws which are there inside
Mm-hmm.
the
Mm-hmm.
medical laws and the medical field, that documentation is important, because with this you can also safeguard yourself. Why? I'll tell
Yes.
you one thing. So there was one case which had happened, that the patient was a cardiac patient, okay, and the the physiotherapist, no, not the physiotherapist, I'm sorry, the cardiologist had touched the patient for a 2D echo, and suddenly that lady started screaming that no, 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 why are you touching me, this and that. Again, there was a female doctor which was there inside, but before that they had already taken a consent for 2D echo. Okay, so that consent, that documentation helped the doctor to safeguard himself that yes, the patient had already signed, and that is why I had touched the patient for 2D echo. So, these documentation, these care plans, these signed documents is very important for us to safeguard ourselves from any medical legal cases. Sometimes
Right.
doctors also tell that, oh, no, no, you did this exercise and that's why the pain increased. But actually, if you document what exercises have been done, it will never backfire on you. Understood?
The same thing happened to me also, ma'am. I also recorded down all the exercises and protocols, and yes, I was saved once by this. So thank you, ma'am.
Yes. So this is the most common thing which I want everyone to follow, everyone to discuss. And if you discuss, again, this is also an advantage. If you already discuss the care plan with everyone, no one will ever come to you and tell you that why did you do this? Right? So the communication, collaboration, care plan strategies, documentation, and interdisciplinary work will make sure that you are also working well and we all are working for the good health for the patient. Clear?
Yes, ma'am.
Yeah, ma'am. Thank you.
Was it